Hello and welcome to my channel. My name is Peter Abraham. I'm a second career registered nurse with a focus in hospice and palliative care. I'm also a certified end-of-life doula through the International Doula Life Movement, as well as one of their part-time instructors driving their continuing education program. And I am currently developing a brand new course, which is going to be part of today's topic, along with other updates as to how things are going. If you're new to this channel, welcome. Thank you so much for taking the time to visit and spend some time. In this channel, we talk about things related to death and dying. After all, we are all going to die. We put a lot of planning when somebody is about to be born. I still even remember when my wife and I adopted special needs teenagers, and we weren't talking about birth at this time, but we did know their names and we did know their genders, but it was still, oh, we need a room for Brittany, we need a room for Justin. What things do they like? How do we decorate? We were looking at, oh, do we need to do a 529 plan to put away for college or trade school? So all these different plans come to mind. And those who are having children, they're like, well, we need diapers and we need this and that. Why aren't we doing the same for death? And some of you might say, well, I have my funeral plan. That's well and done. I'm glad that's part of the picture. But what about your living will? What about your power of attorney? What about if you have all of that, which if you do, yay. What if you have all of that in place and then you get a diagnosis that you've never expected and you're not sure how to navigate the healthcare system? Who helps you then? I'm not trying to be facetious with these questions. In the past, it was your family doctor, but nowadays, more and more, our healthcare system is fragmented and in desperate need of a complete rebuilding. We're not talking about Medicare for all, that's the payment end at the end, and we do need a fix for payment as well. But it's broken. So that's why there's a rise of end-of-life doulas like myself out there trying to help people navigate this system as to what do I do? Do I go to this doctor? Do I go to that doctor? What happens? This doctor prescribed a med, and they're going by insurance guidelines. I am the weirdo that likes paging through YouTube videos, educational the majority of the time. Granted, I'll get into some shows I like to catch here and there, but like they just had on regular news, they're reporting that there are drugs out there, prescription medications that doctors are prescribing that dramatically increase through the roof the risk of dementia. Lorazepam, Xanax. What they didn't list, by the way, that's very common is any type of statin, atorvastatin, pravastatin, simvastatin, rovastatin. You name the statin at the end, and you're at high risk for getting dementia. And the doctors anymore, it's not between you and them, it's what do the insurance guidelines say? What does the pharmacy benefit manager say? What is formulary? There's all these different convoluted things that they go through. And what they don't tell you when they give you this medication, they don't say, now John or Emma or whatever your name is, they don't say, this medication, yes, let me do what stands, for example. We'll get on to today's topic and move forward, but bear with me, please. This statin here, yes, it will lower your LDL, what we would refer to as your lousy cholesterol. It'll lower that number, and it should increase your HDL, which is often referred to as your healthy cholesterol. It should modify your numbers. What they don't tell you is, number one, our brain needs cholesterol. They don't tell you that it is controversial. The cholesterol is the problem in the first place when it comes to heart attacks. There are two prevailing theories for atherosclerosis, hardening of the arteries. There's two theories, and they're theories because they're not laws of science. They're not proven. It's still, the jury is still out. So the statin will lower these numbers. They'll lower the LDL and increase the HDL. So it's fixing the number. Is that helping you? Well, the absolute risk reduction. Almost every medication out there has two sets of percentages. The relative risk reduction, which is pure marketing language. This medication compared to aspirin, it's 97% better than aspirin, or it's 100% better than this. If they're doing comparison, it's the relative number. Absolute risk reduction for statins, which is the real benefit, is 0.8%. 0.8%. So for less than 1% risk reduction for risk of having a heart attack, risk of having a stroke, risk of having a cardiovascular event that might kill you, less than 1%. Increased risk of cognitive impairment that could lead to MCI, mild cognitive impairment, that can lead to dementia. Increasing blood sugars that could lead to prediabetes. And by the way, if you get diabetes, that will harm your kidneys and it will harm your heart that they're trying to protect. How messed up is that? Worsening muscle aches and pains. Sometimes it don't happen until 10 or 20 years on the med. They don't tell you these things. They don't tell you these things. So end-of-life doulas, I'm going to use some fine print here. I get away with this because I'm a registered nurse and I maintain my license. A regular end-of-life doula, this would be, they're not allowed to give medical advice. I can. And I do within the scope of my practice. And I do say, talk to your healthcare provider. And I give them the resources, including the studies, to have conversations with their doctor about, because somebody better ought to, I'm not sure how to word things, bloody advocate for our family members and our loved ones. So these are the type of videos that we put out. Videos from my fellow hospice nurses, holistic nurses, end-of-life doulas, and caregivers. If you like this type of thing, subscribe, hit the bell notification, do like the videos. It helps the YouTube algorithm. This is an extremely small channel. It might be years, and it's not doing this to get monetized because we are looking at years if it even happens. I'm doing it out there to try to share, here's my journey now that I've gone from, I'm a hospice and palliative care nurse up in Pennsylvania, really enjoying it, loving it. It's my calling. Come down to Kentucky and everything's like 12 or more hour shifts, and I can't find part-time day shift work. So, hey, I've been doing end-of-life doula for over a year and a half, even before I moved to Kentucky. Why not turn it into a business? Why not add in RN Concierge services and do all this? So I'm sharing my journey as to how this is going. And so that's part of the picture. So getting into keeping things moving along, the topic for today's video, we're actually going to cover several things. Several things. Some of it will be just snippets and other things more in depth. So the first thing that we're going to cover is on Sunday, August 10th, from 5 p.m. to 6 p.m. Eastern Standard Time. I'm going to be presenting in conjunction with the International Doula Life Movement a continuing education session for end-of-life professionals, predominantly doulas, on palliative care. What makes palliative care different than hospice? Why should we be promoting the early adoption of palliative care? What are the benefits of palliative care? How do we have conversations with our families on palliative care? How do we document everything that's going on in the right way, obeying HIPAA, even though we're non-medical professionals? So I'm doing that this coming Sunday, August 10th, and there's an opportunity for a small fee for how to phrase this. Anyone who ever goes to the International Doula Life Movement, doesn't matter if you got their cheapest class, doesn't matter if you bought 10 classes, you get free continuing education for life, no charge. So you could sign up for this. There's in the movement, that's the app that is used to communicate different things. It's like Facebook, but not. It's not Facebook. It's its own application. It has a mobile version, but it's very private. So you could have a little bit more open-ended discussions and not worry about, is it a public group, a private group? Who else is nosy in, so to speak? So IDLM students are going to attend this for free. And any event that's a continuing education for free. And they have a portal for this. So they can go and look up past episodes because it is going to be recorded. But for a small fee, if you're outside the IDLM community and you want to know what are these sessions like, I'm interested. I don't know if I want to take a course with IDLM. What's the education like? At least from Peter. I can't speak for others. $10.95 fee. I believe that is extremely fair for an hour presentation where you're also going to receive you're going to get 4 handouts. And then when the recording's back, we use Google Meet. So when Google processes everything, and whether it's Anna, Ryan, or Cynthia, they like to go through and they do editing of the video to make it more polished. But when that's ready, typically 72 hours or less, most of the time it's under 48, I'll be emailing those that pay that small fee. So you get the recording and you get 4 handouts closely relate to the topic. So we're going to go into tutorial mode when we get into this, where I'm going to show you some different things. There'll be a segment where I just briefly go over without showing you the individual slides, because that would kind of mess. Why pay the $10.95 if you can actually see everything? But this is a very meaty presentation. Then we're going to jump into the next topic. I am working on a course, 16-week course for my fellow end-of-life doulas and any end-of-life professional who's interested, based on the book, Crucial End-of-Life Conversations. So this is available on Amazon. I'll include the link in the description below. But starting on the right now, tentatively, Tuesday, January 13th is going to be when the first class starts. It's going to go from 7 p.m. to 8:30 p.m. Eastern Standard Time. So it's 90 minutes, an hour and a half, Tuesdays and Thursdays. So starting January 13th, and the tentative end date is Thursday, April 30th of 2026. So that's 32 sessions, so to speak. So twice a week over 16 weeks. An hour and a half, so that's 48 hours if you do the math. And I do plan on, and part of the reason why I don't have it later in the day is I am planning that if people want me to stay on longer, because even though there's time going to be built in for questions and answers and breakout sessions and so on and so forth, I want to be available to my students if something's just not clear, or what do you do in this situation, or what do you do in that situation. So that's going to be a topic. Again, we're going to switch into tutorial mode. And then I do want to give you the latest update on the 6th book in the Bridges to Eternity series that this book is a part of. So this is currently a 5-book series. Book 1 is Becoming a Death Doula, Foundation and Practice for those who, it's not a replacement for going to a school. But for those who can't afford a school and they could afford the book, it's $20.95 for the print version. This gives you a head up. Like if you want, I can't afford school, but in the websites out there, I need something a little bit more deeper than that. That's book 1, Foundations in Practice. Book 2 is Becoming a Death Doula, Business Growth. How do you grow your business? Book 3 is this is where my short-term memories, I'm looking over here, is like this. I believe it's Creating Meaningful Legacies. I get book 3 and 4 mixed up. I think book 3 is Creating Meaningful Legacies, where I present 50+ legacies using SMART goals, specific, measurable, realistic, attainable, time specific. So when you're doing legacy projects for those that are end of life, time matters, no pun intended. And you could walk in where the family tells you, hospice told us 3 months, and the next time you go to work on the project, they're saying we got a couple days. So that's why in this book, that like it's starting in chapter, I believe it's chapter 4, what if it's a 6-month prognosis, chapter 5, 3 months, and so on. And then one of the appendices, this is your emergency kit. What if you're working on this and we don't even have 2 weeks? What do you do? So all of my books are geared towards helping you master your stuff. And so I believe it's book 3 is creating meaningful legacies. Again, I might have the numbers mixed up. Between book 4 and book 3. Book 4 is doing a vigil planning. So in my experience with hospice and palliative care, and again, this is mainly in PA, but I'm the geeky nerd that loves network. When I say networking, I'm not talking about in person. I'm going to be doing that this week, several occasions of networking. But I get shy about it. But anyway, with Vigil, a lot of the places out there do it by the seat of their pants. They do. And I'm not saying there's nothing wrong with that. They actually do make it work. It's like planned chaos. However, as we as doulas, if you're in a position to work with and do the planning we're trying to encourage, like you plan for birth, why not plan for death? As part of the like, okay, we got your advanced care plan done. Why not? Let's talk about your obituary. Let's talk about your eulogy. Let's now talk about the vigil and really plan that out. So that book really dives into the meat and potatoes of having the most wonderfully planned vigil possible. Again, at the mastery level. Uh, and if you're watching this one day, that might be that might be a mini course. I don't know if you could probably make it 16 weeks, but I only have so much time. I love what I do, but oh my, there's no pressure. So that's book 4. Book 5 is creating meaningful legacy. So book 6 is going to be crucial end of life discussions. And I'm sorry, book 6 is going to be the end of life care planning. Oh my word, my memory. So end of life care plans, which is so important. So before I go on and actually show you and stream with you get into the true topic of today's video, I like to engage my viewers on building resilience. I strongly believe there are 3 pillars. We work on the 3rd pillar in this channel. For those of you wondering, pillar 1, I'm not trying to turn you off if this isn't you. Pillar 1 for me is my faith in Christ Jesus. Pillar 2 is who can I forgive? Who haven't I forgiven? Maybe I did forgive them and maybe it cropped back up and I have to reanalyze. I thought I did, but now I'm going through these feelings. Maybe I didn't. Let me work on it again. But the 3rd one is what am I grateful for? I believe everybody has something that you can look at. What are you grateful for? It might be that you woke up this morning. And for some of you, if you've been at dark places, I've been there. I'm being transparent. I've been places where I woke up and I wasn't planning on waking up. Really gone. And but I've learned to, hey, this is a good thing. God's giving me another chance today to have a do-over. Not in the truest sense of the word. This is not Gopher Day or what's the movie? I can't remember the actors, but um, the day repeats itself. Comment below if you want to help me remember. I think they're a gopher. Oh my word, I can't. What is the animal that comes up at certain time of year that they tell summer? But anyway, if you comment below, it would help me with my short-term memory. But here, what are you grateful for? What are you grateful for? So as I look at what I'm grateful for, um, my wife is working on a surprise to help me for August 18th. So I've been sharing with everybody watching the past couple episodes that part of my gratitude is I'm taking a leap of faith that we're not there yet, but I'm still leaping from a point of view. Um, a local attorney, thank you so much, Helen. Helen has Mama Bear, where she not only helps people who are injured in vehicular accidents, but she is also a legal American immigrant. She just celebrated her, what was it, her 24th American birthday. I said happy birthday that day, Helen, but happy belated birthday again. I am so proud of you. And she is so such a beautiful person trying to help all the local businesses and small businesses in Berea, especially in Madison County at large, where she's put together an event for Last Will and Testament, and I got a booth. I got an 8-foot table, and I worked with the Chamber of Commerce. Do I need a tablecloth? Yes, you do. So my wife and I went shopping this past weekend, and we got it's a type of orange, but it has some red in it. She actually told me that I think it's zinnia is the color. Don't quote me, but she's actually working on getting that hemmed and so forth. So we have the tablecloth. The previous episode about building resilience, that's just one episode behind this one. I actually showed you the table runner. And I'll put a link in the description below again for that because it's actually under 30 bucks. Wow. And I was sharing this. I did a monthly mentor call the other day with Anna and Serena and oh my word, is it Diane? Or I apologize. I apologize if you're watching this video. I forgot your name. And actually, you sent me a LinkedIn request, and I can't remember. I'm sorry. But I was sharing this. My wife actually came out and showed the table runner. She doesn't like to be on camera, so I was proud of her that she even came up and showed. And I'm grateful for that too. But I'm moving forward for that. But she's working. She got some stuff from Etsy to try to fancy up the tablecloth, and she got another thing to put on an emblem on a shirt. So I get to go to that. And then this past Sunday, and this is part of the gratitude, I'm out there in the community, as nervous as I am for all of this. I'm an introvert at heart. I could be the person on a deserted island and give me, I do need proper utilities, but give me a couple books to read and I'll read and write and whatever. But I could be there and not be lonely, but not, if that makes any sense. But this weekend, I went to a caregiver group that a local person started. And I don't want to mention names for now because I don't got permission. And the group's just kicking off. And again, I don't have permission. And this is about their journey, not mine. And I'm going to that group. Not only am I freely going to that group, but I'm contributing to that group for free. So if you're one of the group members and you're seeing this video, when I said on Sunday, August 3rd in the meeting that I'm planning to give whatever I can freely, I meant that. That it wasn't freely, and oh, by the way, here's my business card. I did bring cards with me, but when I got there and I saw the struggles that different people were going through, I said to myself, and granted, I'm probably going to get chest. I love my wife dearly, but it's like, you can't keep giving everything away for free. But I like helping people where I can. And so I'm doing what I can. I'm not saying I can donate hours if for any of you watching that are in the group, but I do plan on giving educational sessions. And in fact, for one of the family members, I did an article that I got published on compassioncrossing.info for Monday. Normally I don't do that, but it was a medical event that this person brought up that I remember reading about in nursing school. It is very rare, but when it happens, it is beyond frightening for caregivers and family members. So I thought, I did some research. It happens. As an FYI to give you a clue, not without giving names out. But anyone who suffers a traumatic brain injury has the potential for their nervous system to go out of whack in a very scary way, frightening. And so I wrote an article and got that out there, dealing with how do you prevent it. Uh, what are the key signals that it's oncoming that you might be able to reverse it, and then what do you do if it's full force, and just to raise awareness of what they're going through. And it's by going through this meeting that I was so grateful that they allowed me to come. They say they were happy to have me there. They're like, we need somebody that is a doula, that is a now in my case I'm also a nurse. Um, And I tried to share with them, they're the experts for their loved ones. They are. I might know drugs and names of this and that, but I don't know their families. They're the experts on their loved ones. And I'm saying that if any of you are caregivers, I'm saying that to you because as a hospice nurse, I've had too many people come up to me. Whatever you say, you're the expert. Caution. I know I said I'm weird, and most of the time with this, if I recommend that somebody stop a med or start a med, I'm not trying to be proudful, but the majority of the time I'm right. And not only because of it's out of my head, I'll check with pharmacies, I'll do my due diligence. But they know their loved one better than me. I am a human being. Don't put me or any other human being on a pedestal. Anytime information is conveyed from one human being to another human being, no matter what the heart is at, I believe my heart is in the right place. Does that mean that my information is valid? Does that mean my information applies to you? Part of the reason why I write the books the way that I do is to give you, the reader, the tool for you how to think for yourself. And I don't say that to say, see, I don't have to listen to anybody. That's not what I'm saying. I'm just saying, when you hear something, do your own homework. Does this make sense? My doctor said this. I'm going to use me as an example. My doctor said this about statins. If I come out, I'm going to die. I literally had people tell me their doctor told them they're going to die immediately if they come off. It's beyond false. They were lied to, and I'll put that on. This is on camera. This is on video. They were outright lied to. I hate stuff like that passionately. It lowers the risk by 0.8%. That doctor would have to provide scientific proof to back up their statement. But here, at the end of the day, that person has the right to say, I'm going to stay on this even if I get dementia. That's their right. But at least hear the person out. But let's get on back to gratitude before I turn this into a several-hour video. And I thank you for your patience for watching. But here through the group, they're so grateful. In fact, I get home and the person who founded this posted on my Facebook page, thank you so much for coming. And inside my head, I'm going, no, thank you. Thank you for allowing me to come, because everybody that's there is caring for somebody. Some of them, in fact, all of them that were there, 24/7, unless they leave the house. They're the ones that are carrying the overwhelming burden. I get to walk away. I get to one of my puppies is behind me. They're my coping mechanism, so to speak, in part. So it was thank you. I'm grateful to be part of this group. I'm grateful to be able to let me do homework, because what I was doing today, in thanks to this group, is I called UK Health Palliative Care. Granted, I got voicemail, left a message. I reached out to Bluegrass Care Navigators Palliative Care Division out in Lexington. I reached out to the Palliative Care Council of Kentucky, which I did get a response back. And granted, they're checking in to see what they could help, but they responded. I am so grateful for that they responded, because as a side note for those of you listening, I am working on a project now. Right now, this is limited to Kentucky, specifically Madison County, but depending on the answers I get, it might be Kentucky at large. I'm not saying it has to be Madison County only, but I am working on a project to expand awareness to promote early adoption of palliative care in Kentucky. I'm looking at creating, this is a subset. I'm currently creating a resource directory for Madison County. It is incorporating some other parts of Kentucky, but it's a free resource directory for different assisted living, nursing homes, lawyers, different resources. I've had a traumatic brain injury. Kentucky actually has a traumatic brain injury fund, and all these different venues for caregivers to get resources. Oh, there's Horizon Pace, there's Visiting Angels, and all these different resources. Well, I want to have a subset of that, of if there's a palliative care need, where do I go to? Because here's the caveat, and this, I might brush on this in my continuing education session that's coming up on August 10th. But certain palliative care is in a clinic or outpatient versus in your home. A lot of it's very insurance driven. And even though from a practical standpoint, palliative care is for, I have out of control symptoms, manage them, there is the potential, because the regulations, for lack of better words, it's ongoing development. Like hospice is, I don't want to say fine tune in a way that that's a good thing, because there's a lot of changes that have been happening in the most recent years that I really don't believe is patient centered. That's its own discussion. But palliative care is still in that infancy steps. And I want to help be part of get it off the board. And I'm so grateful, by the way, this is going to work my ending part for being grateful, is the Hospice and Palliative Care Association, HIPNA, was looking for state ambassadors for different states. They didn't have any that I'm aware of in Kentucky, at least that's what was reported. I'm sharing it that way because sometimes people will represent something because they're trying to egg people to commit, because like, oh, we have no one, you'll be the first. And maybe they already had one or two to begin with and are just trying to increase the number. Again, I try to be very careful not making myself to be any more important than what I am, which is about there, if that. And but I applied to be a state ambassador for Kentucky for the Hospice and Palliative Care Initiative. And that's not just hospice, it's palliative care too. I got accepted. And today I did my first email broadcast. So that was a good thing, where I'm actually stepping up to the plate. But I'm grateful for those opportunities to promote. So by the way, before we get into today's video, please don't belabor. You just said you were going to lead into the video. If you are in Kentucky and you're watching this video and you work for a palliative care organization, or you can input because you have connections, please, please, please reach out to me. I can't pay you. This is a free project I'm doing, but reach out to me. I want to help people connect the dots. Everyone who was at that support meeting I went to Sunday, everyone could benefit from palliative care. Everyone. It was 100%. And when I'm querying about palliative care, I am getting that there's so many disconnects. So many disconnects. Some of it's knowledge deficits that I hope to fill for free to them. But some of it, I need to get the information to even give them. So if you are in Kentucky, or maybe you're in the United States, and you can just direct me, please comment below. I appreciate that. Non-judgmental channel. So now we're going to go into tutorial mode. There won't be a formal outro. I did put in the tutorial mode video. There is a very small potential, because I'm filming this in advance. This is being filmed in advance of it showing. This is going to be showing on Wednesday, August 6th, 2025, 9 a.m. if everything goes right. Well, in between, I'm having an event that I'm going to that I may have something to say, maybe. Afterwards, I may tie it into at the end of this video or a completely separate video. Not sure. But for now, I'm going to go into the tutorial mode. As part of this update, I just wanted to go over briefly that on Sunday, August 10th, from 5 p.m. to 6 p.m. Eastern Standard Time, and it may run later if there's people who are part of that, want to talk one-on-one or in a small group, whether it be ongoing questions about the material that was presented, or I'll be bringing out portions of how treatments for cancer can be so devastating to the body. And there may be people attending this continuing education night with the International Life Movement that want to be heard and they have a story to tell. And I want to give them time, but that would be outside the purview, so to speak, of the class. But there is a QR code here, and I'm going to be giving a link in the description below on how, if you're not a past or current student of the International Life Movement, you can pay a small fee, $10.95, to participate in this educational event, where after the event, not only would you have been able to learn the different things that are being communicated, what's the difference between palliative care and hospice care? These are crucial differences. Identifying the key diagnoses that benefit the most. How to conversation starters to talk to your family members about this. Recognizing when family members could benefit, and then how to collaboratively work with the different teams. So in addition to participating, and it's an interactive, this is a live session, not going to be pre-recorded, and then you go and you watch it as if you're watching a movie, but I'll be the one presenting. You'll have the opportunity to raise your hands if you're doing this live with me, ask questions and interact. That's one of the beautiful things about the International Doula Life Movement, whether it be myself, Pam Carter and Adams, Robin Silver, Alexa, all the different teachers. These live classes, when they're live or even on site, you get to interact. So for students, it's free, but for outsiders, $10.95. So in addition to that hour, I crafted 4 different handouts that would be very beneficial to use in your practice because of with this information. Everything from going over the diagnoses that was discussed, a symptom tracker, a conversation starter, and to be honest, my short-term memory is like this. So even though I created them today, I'd have to go take a peek on what the fourth was. You get 4 copies, and if you, whether you attend, or we've had sometimes people sign up and pay the fee and then they show up last minute, you will get a copy of the recording if you're a student through the portal, or if you've paid the fee, you'll get a copy of the recording as well. And then just briefly going in, I'm not going to go over the slides because after all, this is not giving it to you for free, but this is a very meaty and lengthy presentation. Currently, we're up to 38 slides. The 39th is a question and answer session. And I know for some people, they focus on a lot of imagery. Uh, there's a time and place for that. I'm old-fashioned. So I do use images where appropriate, but I'd rather give you the meat and the potato, so to speak. Where's the beef versus going over, here is a fancy image to quote catch your eye, and then hardly give you anything. It's like going to, getting fish and chips, and you have this small piece of fish, and then you have this whole basket of French fries, and it's like, and how much did you pay for that? So then going on, moving forward, uh, I am working on translating my book, Crucial End of Life Conversations. Now, this is available on Amazon. There's going to be a link in the description below. I'm working on translating this book into a live 16-week course that's going to be available in 2026. Tentatively, we're looking to start Tuesday, January 13th. It's going to be offered twice a week, Tuesdays and Thursdays, from 7 p.m. to 8:30 p.m. Eastern Standard Time, and ending on Thursday, April 30th. So that all combined, it's going to be 48 hours of instruction. And I am going to make it a point to be available after each and every class. So if classmates, there's going to be room for questions and answers as part of this. There's going to be room for interaction. And I'm going to take you through the right now, just so that you're aware, this is a draft. It's been approved by Anna Adams, the founder of the International Doula Life Movement. But as we go through, there may be changes for the better. And once we get through with the first set of classes, we're probably going to say there's lessons learned and make improvements. And this is one of the things I love about the International Doula Life Movement is almost every time they go through a course, at the end, there's like, we'll add this to make it better. For example, I'm actually responsible for two separate modules on two other courses. The end of life doula course that I graduated from, I'm certified through them. They're doing a basic 101 communications, and it's actually in part a small piece of this. And I'm doing a 102 advanced communication class as well. I'll be that one. I'd have to look up what day in October of this year, 2025. I'll be actually teaching that class live. So I'm so much looking forward to that. But that's from input from the students. So this is not when you go to IDLM. While there are some self-study portions where it is a pre-recorded video, the overwhelming majority is live, and all of this is planned to be live. And what we do as a group, and when I say as a group, I may or may not be involved in different pieces. I don't want to make myself out to be bigger than I am. I am only a part-time instructor. I am in charge of the continuing education division, for lack of better words. And that palliative care, that's something that I created the content there for. I created 13 months worth of classes. And again, I think I shared in another episode because we're doing a 2-for-1, so to speak, in August. Part 1 is palliative care, and part 2 on August 24th is transitioning from palliative care to hospice. So I'm working on developing this course that's going to be available in January. And I just wanted to just give you a brief peek of how it's going to be comprehensive. So each session, 90 minutes, we're going to have case studies. So case studies throughout. And even though this is about, oops, oh my word, I am so sorry. Let me go back. I have too many books open. That's my outline. Oh my, fiddle fingers. This is the actual course outline. I am going to go back to the other outline. So I hope you're humoring me that Peter had a brain moment. Uh, I am human. I have those. And because I only lightly edit my videos, you get to see my faux pas. You get to see the authentic, this is Peter, because I've shared in previous times that you've watched me in real life. There's no teleprompter, and I better not be on my phone. Let me look up what AI is going to tell me to say. We need to be able to operate in our skin, so to speak. So I apologize for my mistake. I did have it loaded in Word. So crucial end of life discussions. Yes, I should have read the title before I went too far. But the short excerpt, the class description, short excerpts, by the way, what we're probably going to use for SEO for those who want. 5 problem knowledge gaps that this is going to solve. I strongly believe as an educator, we can't be out there saying, we have this, look at this, look, bye, look at this. We have to really answer the questions of what it's going to do for you. What problems is it going to solve for you? How are you going to be transformed? How is this going to help your practice? How is this going to help you grow your business, and so on and so forth? So that's where this is going to go over five problem areas that I believe every one of us in this field has. I'm not saying I'm right, by the way. I don't know it all, but this is what I believe is out there. So the challenges, and then we get into the learning objectives for this class. And again, we really have to talk about transformation, because if you take a class, and this is going to be 16 weeks, where the students taking this class, they're investing their time. I'm hoping you're one of them. You're investing your time. Your time matters. Not just my time matters too, but your time matters. You're the one putting out the money to pay for the course. And since this is brand new, IDLM students will be paying money for this course. There might be some who are able to audit because of what they do to help out, like how they help out, but a good number of them are going to be paying. So that's what you need to get your money's worth. So what transformation is going to happen for you? So this is what I believe is going to happen when you get done with this class. And then we go over the course structure. And again, each module is intended to be 90 minutes. I'm going to do my best. Part of the reason we're doing the 7 to 8:30 is that I'll have some time after each class. So the hard part, I'm on the East Coast with Central Kentucky. If I try to have the class too late to accommodate a very large spread of time zones, then it gets into where I'm only human, for lack of better words. And I am not good past a certain time period. And I want to give my best to everyone attending. So we are going to be having case studies. That part doesn't change from the other outline. There are going to be quizzes just to see. I need to be blunt. Are you paying attention? Are you applying yourself? Yes, it's your money, and if you want to throw it away in a point of view, that's your business, but I want to make sure you're getting your money's worth. I want to see, if you're not getting it, maybe I'm teaching it wrong. Maybe it's all on me. Again, I'm not perfect. Maybe I need something to learn or do differently. And I apologize if you're hearing mowing. I do have voice isolation on, but I do have a neighbor that is mowing. And so case studies throughout. And I'm going to just skip ahead real quick because I do want to get into the meat of this, which is actually the end of life care planning book. So there was a reason for going through the other one, even though I didn't want to start there. So again, the modules going through. Validation therapy, Naomi Fell, one of my role models. She's now passed away, but she is a hero. She is an amazing woman. I never got to meet her. It would have been a blessing for him. I guess I meet her in heaven, but like, wow, what her work is outstanding. And I've mentioned this before and I stand by it. I believe anyone can learn the techniques of validation therapy. And once you learn these techniques and you master them by practicing them every day that you can, you will get through so much. Wow, what a difference it makes in the world. I was applying the techniques before I even knew the name of it. Before I knew Naomi Fell. And I'm not saying that I don't know how to word things in certain ways, but like when I was in nursing school, maybe it's because I'm an INFJ, I would just do the things differently, and I'd have nurses, sometimes I don't know if it was because of hazing, where I'd get certain patients and they tell me, Peter, he won't let anyone assess him. He won't even let anyone touch him. You'll be kicked out of that room in under a minute flat. And they'd give me a report, and they'd actually hang out looking to see what would happen. And I'm an introvert. I do have periods where I'm shy, especially under stress, but I am unbelievably weird. And I don't mean that from a bad point. I mean that from a Jesus point. I mean that from a Harry Potter. Not that I'm saying magic is real, because how do you say Jesus and magic in the same breath? But I go into this person who threw everybody out in a minute or less, and I go in, and I did share this story before, but in case you haven't heard it, I go in and I say to the person, I'm taking my stethoscope off my head. I said, have you ever heard your own heart rate? Have you ever heard your own heart? No. Would you like to? And I said, just give me a moment to get the right place. I need to listen just so I'm in the right place. Listen. So I got the rhythm, regular versus irregular. I wasn't counting at the time. That wasn't the purpose of this. And then I quickly handed it to him, let him put him in his ears, let him take as long as he wanted. And then as I went through my assessment, every point, like when I went to go, as I said, I'd like to get your blood pressure. Do you mind if before I even do it, you mind let me share you with you how it even works? It's like it's the person who came up with this is a genius. It's actually creating a mini tourniquet on your arm. And then as I'm pumping it up, and I'm not actually connecting it to his arm, I'm describing it. I have everything in front of me. So this would go around your arm. As I pump it up, it actually cuts off your blood flow temporarily. It doesn't hurt. But what I'm listening till the sound stops, and then I start letting the air out. And then the first sound I hear, and I think it's called Korkoff, don't quote me on the pronunciation. The first sound when I start hearing, I'm looking at the gauge, that's the top number. And then I keep listening. And then the moment that I can't hear anymore, I go back one notch, so to speak. That's the bottom number. So I describe it and said, "You okay if I do that with you?" And then I'll let you do let you do it yourself, so to speak. I'll hold everything. And I was able to do the complete assessment. Now, just so you know, I didn't plan this out. It was not scripted because I didn't even know I was going to get the patient. I'm just thinking on the top of my head in this setting, and the nurse that was like watching was like, never, no one ever thought to do it that way. And I'm not saying as I share this that I'm a genius, I'm not. It's just you have to think out of the box. And a lot of this coursework, including validation therapy, is literally encouraging you to think about the box. Always remember about validating feelings. That's the very core. But everything out of that is thinking out about out of the box because human beings don't fit in a box. No one fits in a box. I mean, I'm not talking about coffins and whatnot for those of you who, Melissa Meadows, I really love you platonically. But some people, if my funeral director friends will go, well, they fit in the box at the end or they fit in an urn. But while you're alive, everybody's different and unique. And I'm not saying they're not different and unique when they're dead. That's its own topic. But everybody's different. So you're on the spot, like, how do I communicate this way? And that's the whole intent of this book and like crafting meaningful legacies and my other works is how to get you to start thinking on your own, using critical thinking skills on your own, that over time you become your own master of the work that you're doing. And so this is the difference. My wife asked me the other day, why can't they just buy your book? Why would they, pay a lot more? Because it will be a lot more than the book. We'll encourage you to buy the book too, by the way, in case you're wondering. This does not. I'm considering whether it will include the book as a gift. I don't know. I'm thinking about it. I have closer to January to work through that. Now, granted, and if you're watching this, she may egg me on that I might need to include the paperback version, which it is. It is. So we'll work through it. I love our IDLM team. And I love cohort 25, by the way. Platonically, just to be clear, you can laugh at me if you want. So quizzes throughout. Cultural competency is so critically important. So critically important. Uh, Practice applications, extended case studies. And by the way, if you're watching this, I hope you are smiling from ear to ear about how many case studies that is going to be planned to be a part of this work. Anna likes case studies. I mean, I do too, by the way. And there's going to be a final exam. Now, in terms of the assessment structure, there's going to be a quiz covering 2 weeks of material at a time, pass rate. There's going to be case studies where I need to do analysis. I do plan, by the way, and I don't know to what degree I have this pre-documented. Again, my short-term memory is beyond horrible. That's why I pay for Todoist. That's why I pay for Notion.so. I take notes on a notepad and have other tools all over the place, so to speak, because my short-term memory is just awful. So getting back, I don't know if we're going to be doing class discussions. There's a high probability. I haven't worked that part out. That might be part of this. Practical assessments, then yes, the final exam is going to be 100 questions. I have not created the final exam yet. It will be realistic, but given that nobody fits in a box, I am not going to be so strict that the 85% pass rate is going to be like that most people fail. So if you do horrible on tests, please don't panic. I want everybody to be able to take this and apply this in their practice. So now moving on to the care plan outline that I started with. Coming back to here, I've been making progress with the book. I may be able to finish the product for this. I don't know if product is the right word, by August or early September in terms of getting it published. Just the other day, I did finish up to, I think I got up to chapter 14. So I don't, if for those of you wondering, whoa, how are you writing? You know, last time we looked, we were this. I'm not giving you updates on the book writing every Monday, Wednesday, Friday. They're interspersed throughout my videos. But let me go in, because again, I have this up here, and let me just show you where I'm at. If you recall, chapter, I don't have everything memorized for the chapters. I think it was chapter 4 was the care plan itself. Chapter 5 through 11 was physical care planning. Chapter 12 is where we're dealing with the emotional issues, loneliness and isolation, you know, body image changes, and so on and so forth. So here, and again, as I'm showing you this and previous updates, this is literally just in draft format. When I get towards the end, when I have all the chapters written, I have all the appendices written, that's when I'll go through and am I on target? Did I overestimate for weeks and months for certain case study portions? How realistic is this? Because where I can, I'm pulling in from different sources for the case studies, but where I can't, I'm going over probable realities based on my years of a hospice and palliative care nurse and what I went through. And I shared my memory. My short-term memory is poor, my long-term memory is better, but for HIPAA purposes, I don't have a lot of stuff saved because this is my own computer. There are certain things that are encrypted. I got to be careful for protecting my client information, so to speak. So we got into why this chapter matters. That is part of every part. The learning objectives, applying in practice, key concepts are going to matter, what makes the chapter special, and how it connects to your work. If you recall, we were talking about, you know, when you buy a book, when you take a class, when you take a course, there has to be what's in it for you. You know, what was oh my word, I can't think of the Tom Cruise, you know, what was the name of the TV, like it was a movie, Show Me the Money was part of it. What's in it for you? So that's part of like, how does this connect to your work? And as I share what's in it for you, what I try to do with every book that I've ever written, my book for my hospice nurses, my book for my holistic nurses, my book for you as end-of-life professionals, my book for my caregivers, I need to have the fine print of it's not just you, but it's you and those you serve. So it's multiple targets. What's in it for you and what's in it for those you serve. So we're trying to connect all the dots. So talking about, and when I can't stress enough, and I can't give every single example of loneliness and isolation. There's loneliness of an isolation, like to give you, I give you one that's very personal to me. I am undiagnosed high functional autistic. I share this. Well, how do you know if you're not diagnosed? Because I've had a number of managers, hiring managers, coworkers, friends say, Peter, you're demonstrating the behaviors as if you either have Asperger's syndrome or something like that. You're on the spectrum. And for many years, I was in denial because I have compassion and I have empathy. And in fact, I still remember when I worked for WellSpan up in New Holland when I was going to nursing school, and the hiring manager, Michelle Henry, when I was going over like my GPAs and all the things like even when I was in IT, how I taught myself a new programming language, rewrote an entire inventory system that was inaccurate to where it was inaccurate of $1 million, a penny on the $1 million, and sharing with her Rain Man type stuff from the IT perspective. It sounded like you sound like you're artistic, but that doesn't make sense because you're also being able to connect with people. And then I later found out from just doing research and hearing from other people is you can be high functioning autistic and still have empathy. So I don't want to go down too far down the rabbit trail, but in terms of getting down to the how does this connect to isolation, is when you are neurodiverse, maybe it's ADHD, maybe it's the autism spectrum, maybe it's somebody who's bipolar or something schizophrenic, something is off, mental illness in general. And those around you don't have any of those things. I need to be blunt and ask the question, who understands us? I have people who try. I'm grateful. But at the end of the day, most don't. I'm not playing the victim card here. I'm not like crying about it. I'm not depressed over it. But it can get extremely lonely because I'll try to explain the thought process and for lack of better words, nobody has the time, which can be frustrating. But again, I look at it from the perspective of this is part of the cards I'm dealt, and I'm out there to serve anyway. So that's an emotional hurt I just have to work through and deal with while I'm trying to help others and work through. So a lot of times getting back on track for the book, you're going to see this when a person's been being taken care at home, or maybe they've been living at home and now they need to be in a facility. No matter whether it's personal care, assisted living, memory care, skilled nursing, this is a dramatic change, no matter how much they make it feel like home. So this gets into understanding the roots of isolation. There is a difference between loneliness and isolation, common causes. And in terms of when you talk about care planning, I mentioned in previous episodes, I believe, again, you're going to do you at the end of the day, but I believe we have to have a curious mind. We have to be willing to get out of our comfort zone, ask open-ended questions, and explore. So I try to hear, a lot of open-ended questions where possible, understanding the patterns. Then it gives creative ways to maintain relationships. I'm trying to not just present a problem, but what are the solutions to these problems? I'm not guaranteeing the solutions will work, but this is part of, if I can give you enough meat to chew on, or fish, or vegetables, you can go, this is a good start, but I came up with this. More power to you because I'm not competing with you. I'm trying to plant the seeds to help you bloom, help me bloom, and help others bloom. That's how we all succeed. Rituals matter so much. And then this gets back to the planning tables. So if you don't remember from previous episodes, I mentioned about nursing care plans is what's the problem? What are the goals? What interventions are we going to take? And typically in a full-scale plan, you might have what's called ADPI. What's the assessment? What's the nursing diagnosis? What is uh, the plan? What is the implementation steps, and how we're going to evaluate how things are working through? Well, I like to keep things simple and smile for my end-of-life doulas. So what we're looking at is what is the concern, which might be a problem or a risk. Um, what are the interventions that we're going to take? And what are the goals in mind that we're hoping to achieve? We can't guarantee that we will achieve them, but what are we going to try to do? And where possible, some of this is exploration for the interventions. We may not have the answer at the time, but we're going to explore. And so just giving you ideas and video calling, and then just going through another care plan table. And again, these are just examples. Building support networks. If you haven't noticed at the bottom down here so far, 316 pages. This is truly, it's probably going to be an 8.5 by 11 book based on the number of pages. I may end up making it a 6 by 9. But the caveat with that, bear with me one moment, and I thank you for bearing with me. This is a 6 by 9 book. This is my longest book prior to this book. That is a little over, look, 532 pages. So 532 pages long for this book. And we're already up to 316 pages. And I still have a number of chapters and appendices to go. And this is an ebook format. So this is an 8.5 by 11 with the most narrowest of margins. So if I put this in a 6 by 9, it's probably going to bloom up to be 600, 700, 800 pages. I have no idea yet. That could be very expensive to print, and I'm trying to keep these priced at an affordable price. And forewarning, because I don't know the ending page count. Forewarning, this may not be like my other paperbacks that are $20.95 a paperback. That's my target for all my building, my end of life bridges to eternity doula books. But this might be one where, because of the number of pages, there's print cost. It might be more. So the inner would probably fit me. Communication. And I know I'm speeding along a little bit in two parts. One, I've shared this is not a way to give you the book for free. I'm not being sarcastic or facetious. I'm not trying to be mean either, just trying to be realistic. But we have case studies. Again, giving you care plans through the roof, so to speak. Because the entire book is how do you put this into practice in your world? This is getting into cultural sensitivity, and this, by the way, is not the chapter on that, but I'm trying to incorporate it where it fits. At the end of every chapter, there's a taking action portion. How do you take this and put it into your practice? And we break it down into, for those of you who are new, those of you who are experienced, some quick references, some of the common challenges and solutions, working with community resources, some documentation examples. As a side note, the font may change for what I'm doing here for the sample documentation. That's the best I have for now. I've learned as I write, if I focus too much on perfection as I'm writing each paragraph and chapter, we wouldn't be talking, we'd probably be talking towards the end of the year or next year in terms of publication. I want to have a quality product. So when I'm talking about this, I'm not saying skip quality and cut through. I'm just sharing certain changes I don't have to drive myself nuts on. and get through analysis paralysis. And then at the end of every chapter, how do we prepare for the next chapter? And I'll just briefly, loss of independence. So there was an intro to this, unless there's a potential, because I film in the advance of this coming out live. But there's a light potential. There might be more to this tomorrow, but which there'd be an outro after this. But otherwise, in case there isn't, I do appreciate you. I appreciate your time. Thank you so much. And until next time, God